So anxiety is a natural response to stress or to stressful factors which we have in our life. For example, going through any new changes, moving from one city to another city, moving from one country to another country, going for job interviews, going through major life changes. So this can lead to various forms of anxiety. Now, to understand what anxiety is, basically we start feeling apprehensive towards all these new aspects which gonna come in our life, and then it starts interfering our day-to-day life activities. Now let's understand what are the symptoms, how exactly it manifests in terms of physical response. So our heartbeat might increase, we start feeling nervous, we start feeling anxious, we are not able to focus, we are not able to concentrate, we are not able to perform our day-to-day life activities, we start getting irritated at very minor issues because we are anxious all the time. So when these things are start happening at once and start affecting our day-to-day life activities, then we need to take a call in terms of to seek professional help, because it's bothering us on a regular basis and affecting our day-to-day life activities. So I think if anyone is struggling to understand what anxiety, focus on if it starts affecting your day-to-day life activities on a regular basis. If it is helping you to some extent in terms of going forward in your life, it's absolutely fine. If we are able to overcome with it, it's absolutely fine. But if it starts causing impairment in our day-to-day life, that means we need to seek professional help. There are two options which are available. One is medication and second line is psychotherapy. But what happens before we go into that, what happens usually individual try to start doing natural remedies for it, like for example going for physical activities, practicing yoga, meditation. To some extent it helps, but we need to understand that these are the lifestyle changes. These are not the primary or first line of the management when anxiety goes at disorder level. If it is there at minimal level in terms of helping us, we can go forward with the natural remedies, in terms of going ahead with yoga and physical activities. But when it comes to medical line, or let's say medical management, there are two aspects. One is taking medication for it, second is psychotherapy. Why medication plays important role here? Because anxiety is a biological illness too. We need to understand that there are certain neurotransmitters which are playing very important role in terms of serotonin. It gets released in a huge amount. So we need medication to create the imbalance among these neurotransmitters so that we can perform our day-to-day activities by subsiding our anxiety. So that's where medication comes into the treatment line. Then the second aspect of treatment is psychotherapy. It's a scientific approach. For example, there is a therapy that's a first line of therapy when it comes to treating anxiety or depression. What we call it cognitive behavior therapy. So cognitive behavior therapy, what it does, when we go through stressful time, we develop few faulty pattern of thought process where we become negative. We are not able to see any positive aspects in our life. So with the help of cognitive behavior therapy, we try to understand what are the faulty pattern of thought process an individual has developed. What we call it cognitive distortions. So we identify these distortions with the help of cognitive behavior therapy. Once we start identifying it, we start breaking it. Now, why do we identify it? Because we need to understand why we are feeling anxious. Because it has got direct connection with our thought process. Now, when I'm saying thought process, we need to understand that how do we perceive world around us? What kind of meaning we give to it? What kind of situation we go through it? How do we deal with it exactly? So these kind of thought process creates emotion inside us. So basically thought process has got direct connection with our emotions, the neurotransmitters what we have in our brain. So by identifying those cognitive distortions, we start breaking the distortion with the help of few more techniques which comes under the cognitive behavior therapy. Now let's focus on behavior. Now why I'm saying behavior? Because what happens, thought affects our emotions and combination of thoughts and affect starts affecting our behavior. So whatever we are going through thoughts at the thought and emotion level, it starts reflecting on our behavioral level. For example, not able to perform our activities, not able to do anything. A lot of behavioral changes happens. We get irritated, we get angry, we get agitated, we feel restless. So even to help person just to calm down, we use the behavioral technique what we call relaxation, what we call JPMR, Jacobson Progressive Muscle Relaxation. We help an individual to relax them first so that they can understand what is happening, or to understand what are the root cause that is creating anxiety in us. So when we go ahead with therapy, we help an individual to understand what are the root cause, because most of the time patient come and say, I'm feeling anxiety, but I don't know what's the reason why I'm feeling anxious. There could be so many reasons that they are not able to identify. So therapy helps us to understand what is the root cause of it. Of course, neurotransmitters are also playing a role. That's why sometimes we are not able to identify the reason, because biological is just happening. There's a lot of imbalance which is happening inside the brain. But again, there are a lot of unresolved conflict where we need to work on with the help of cognitive behavior therapy. There are different therapies as well. For example, mindfulness-based cognitive therapy, then acceptance behavior therapy. So there are various forms of therapies when it comes to psychotherapy, but first line of management when it comes to therapy, cognitive behavioral therapy is the most commonest used therapy. So there are different types of anxiety disorders, starting from generalized anxiety disorder, panic attacks, social phobia, or any other forms of specific phobia, then OCD, what we call obsessive compulsive disorder, then somatoform disorder, dissociative disorder. All these things are part of anxiety disorder. Anxiety is not something where is only one thing which is bothering us. There could be many reasons which could be underlying factors. So we need to understand what are these underlying factors with various forms of mechanism. First line mechanism, the detailed clinical history needs to be taken by trained mental health professional like psychiatrist or RCI licensed clinical psychologist to understand what are the root causes so that we can go further in terms of management. When it comes to management, there will be again two types of management which will be taken forward. One is medication, which will be done by the psychiatrist, then psychotherapy, which will be done by the trained clinical psychologist.